Hello and welcome back to the live broadcast. I'm Cary Adams, the CEO of UICC. A wonderful day to close the care gap. Now, it's my great pleasure to introduce someone that I've known for many years and whose company I've enjoyed immensely, who's achieved a lot within the company Bristol Squibb. Amadou Diarra has been committed to helping UICC and other NGOs around the world for many years. And if I had to describe him without naming his title, which is called Global Policy, Advocacy and Government Affairs, actually if you read his CV and see where he's been around the world, there have been some common themes addressing inequity, inclusion, making sure there's no reductions in disparities. This has been a theme right through the whole of his career, and certainly whilst I've known him, he's been a great ambassador for the role of the private sector in addressing some of the major cancer challenges we face around the world. So Amadou, it's a delight to welcome you. Thank you very much for your time. I would love it if you could start off by telling us, through your career, where do you think the cancer care gaps are? And once again, thanks for joining me.
Thank you, Cary, and thanks for having me on an important day such as this one, the World Cancer Day. And I want to take this opportunity to congratulate you and UICC for all you're doing for patients around the world. So the most concerning gaps for me continue to be what you mentioned. It is the divide about health equity. And in fact, this touches on the social determinants of health, which prevents some populations from attaining their full potential. And this divide results in gaps from prevention to diagnosis to care and treatment. And it's about, the lack of availability of information, but also the lack of trained healthcare professionals, and this goes on and on to facilities, equipment, and of course everything which relates to distribution channels, availability of treatments, and also funding, which is a nerve of any sustained action that we want to have.
Amadou, I mean, you've covered a lot of ground there, and I think we've seen progress in some of those areas, but what are the ones which you feel are the biggest challenges to overcome in terms of the gaps in getting medicines and treatment to people in parts of the world where it's actually very difficult? What do you think are the key things that we have to do? What would you say that the characteristics of a program or project that actually will work? What are those challenges?
So it is a key question, Cary, and in fact, I think the key word is complexity. Complexity of the challenges. First of all, cancer is not one disease, but many diseases. And in terms of complexity, as I mentioned, the availability of information, trained, healthcare personnel, facilities, and so forth, gives a perspective about complications. When we look at the numbers, because the numbers speak for themselves, speaking about cancer itself, it's about, for 2020, 10 million people worldwide died from cancer, and 70% of them being in low, middle income countries. And if we fast forward, unfortunately, to 2040, the expectation is to have 16 million people dying from cancer, and 2/3 of them being in the developing world. I think having that in mind, and also the limitations of access to care and treatment, this is really giving a lay of the land in terms of the difficulties. There's one complicating factor that I wanted to mention, which is COVID-19. As we know, COVID-19 has diverted resources and has delayed diagnosis, delayed access to care and treatment, and therefore it is layering on top of the complexities that we had already mentioned.
No, I think you're absolutely right, Amadou. The COVID 2 years has sort of brought to life a lot of the challenges that we face in health systems, full stop. let alone dealing with the cancer challenges which exist in every country. One of the values of World Cancer Day is that we're able to celebrate the great work done by organisations and individuals around the world and actually step back from the problems and look at the successes, the things that have worked, because we are making progress around the world. We do have more medicines, we have better technology, more diagnostics, you know, and in some parts of the world where they have all that in place, we're seeing reductions in the number of people who die from cancer. So what do you think are the real successes that you've seen from your position where you can say that was a success and that's something that's going to make a difference to lots of people over time because it can be reused, it can be redeployed around the world? Where are the key successes that you see at the moment?
So clearly, Cary, I like your optimism, although much remains to be done. I think we can celebrate some of the successes. And for me, there's no standard, one size fits all response in terms of overcoming the access barriers. I think as a pharmaceutical company, a major biopharmaceutical company, Bristol Myers Squibb, we recognize that we need to partner with governments and other stakeholders, such as UICC. Basically, one of the examples that you are no stranger to is the collaboration between Access Accelerated and UICC, which has given way to City Cancer Challenge, by providing seed funding. And, it's really pleasant to see that among the accomplishments, there are already 11 cities around the world in low middle income countries where we have, already observed that there are improvements in terms of access to equitable quality cancer care. But if we look forward, the perspective is even better because, up to 54 million people will benefit from increased access to quality cancer care. So I think this is one of the accomplishments, and it is also illustrating the perspective that I was mentioning, which is collaboration, partnership, will be essential. If we stay within the Access Accelerated arena, everything that has been generated as evidence from various countries, China, Colombia, Salvador, Ghana, Kenya, has helped secure up to $355 million of new investment in non-communicable diseases. And this is really supporting national policy changes in a variety of countries, 14 countries so far. Now, turning to the more BMS perspective, there are a variety of successes which has been achieved or are in progress with partners. One of these is to try and bridge the information gap that I mentioned, the Advocacy Exchange. And this is a program that was launched by BMS and Grit Health back in 2020. It is the first of its kind platform created to unite advocacy organizations, patients, caregivers, industry, and healthcare representatives in the exchange of information. In terms of the numbers, more than 31,000 people so far in 150 countries have visited the exchange. And it is pleasant to see that 53% of the website users are in low and middle income countries. So this is a pleasant milestone in terms of trying to bridge the divide from an information standpoint. I'll talk briefly about the accomplishments from BMS Medical Department, which set up a global health equity platform. Just a few metrics here. We've launched Cancer Links programs in a variety of countries, and we've worked in collaboration with academics, but also various experts, cancer centers, and society. And so far, 150 healthcare professionals, 200 patients, 200 patient programs actually, and 4,000 patients have received care through this program. Now, the ambition doesn't stop there. We have initiated a partnership with the eCancer Global Foundation, and the aim is to reach throughout Africa, Asia, but also Latin America, about 100,000 healthcare professionals. So these are some of the accomplishments. And just to close on this platform, we shouldn't forget one of the vulnerable populations, which is the pediatric population. And there is a partnership going on with World Child Cancer UK to try and close the gap in pediatric oncology. And so here, the program that we have initiated is aiming to reach over 1,000 healthcare professionals in Ghana and Cameroon. And this is a promising start. Now, just to finish, I want to talk about the Bms Foundation, which you are familiar, Cary. And the programs that have been funded by the foundation have trained over 4,000 pediatric cancer healthcare professionals. 10,000 patients, pediatric cancer patients, were treated. And from a lung cancer perspective, the foundation is also training up to 4,000 healthcare professionals. I know it is a lot of numbers, but all the more reasons to be optimistic and positive about what we can do together. And once again, partnership is key.
No, and maybe I can re-emphasize some of the points you made there, Amadou. I, as you recall, I think I spoke to you many years ago about the City Cancer Challenge when it was purely a concept, an idea. And certainly your support and the support of Access Accelerated have really helped establish that foundation, which is now celebrating, I think it must be its 3rd year of operation, and it's grown, which is really good news, and one of our sister organisations. And also, I had the privilege of being on the Advocacy Exchange, and the work you've done with Grit Health and Dave and his amazing team, and all the work there has touched so many patients' lives around the world. It's extraordinary. And as you know, I'm also on one of the advisory groups of one of the recipients of the support from the Bms Foundation, being Global Hope, which does tremendous work on children's cancer in Africa and really is having an impact on young people's lives and saving their lives. So, a lot of the things that you've invested in have been very wise investments where your approach has been to seed it and get it going and then crowd in other support and then crowd in partners. So I think you should take a lot of thank yous from me and from those who've actually received your support over those years. Now, another thing that you support is, of course, World Cancer Day. And without your support and the support of others, we wouldn't be able to put on such an incredible event around the globe, trending on Twitter as we're speaking. I think it's trending 1 in the UK now, it's trending 3 in the USA. It's raising the profile of cancer, it's creating an opportunity to talk about the subject of inequities and to really engage the media and social media. So why do you invest in World Cancer Day? And please don't stop, but why do you invest in World Cancer Day? I mean, it's clearly, it ticks something which you think is worthwhile doing.
Thank you, Cary. And I keep in mind your instruction not to stop. I think the simple answer is really because there's clearly more to do. And, it's better done if we join hands to do it. And so we're very proud to partner with UICC, as you know. I believe it is a shared responsibility that we all have, and it requires really a broad range of partners. So we cannot just talk about, disparities and the gaps. We need to act, and, we need to focus our actions and coordinate them so that we avoid duplication, and we need to really leverage expertise. I think one example of partnership that you also know about is the partnership with Olucan, and this collaboration is an example of how driving efficiency in cancer care can support a sustainable health system. So we're very proud to be associated with UICC, but we're not the only ones, obviously, and this is the greatness of what you're doing.
No, well, I mean, it takes collective action in everything that we do because it's such a big, as you said, complex subject. It needs multiple organisations with different experience, knowledge, background and resources to make a difference. So what's BMS doing around your business today for World Cancer Day?
So first of all, there's not one single BMS employee that doesn't know that there's a celebration of World Cancer Day with UICC, and in some countries like Japan, I know that there are specific, events organized. But it is a day for a profound, reflection. As I said, we have reasons to be proud. We have reasons to be hopeful, but we have reasons to, do more all collectively. And for BMS as a single company, looking at the innovation aspects, but also educational aspects and everything that we can do from an access perspective. One aspect that I did not mention from an access perspective is an initiative which, we can certainly talk about in the future, which is partnering with the Parker Institute for Cancer Immunotherapy and the Clinton Health Access Foundation, try and do a demonstration project for advanced therapies such as immuno-oncology agents in a low-resource setting. We are building on the learnings that we have with another partnership that we have with the Bms Foundation, and this is more on leukemia, but the learnings are really positive, and there are more than 1,000 patients that have been treated, most of them in Africa, with this program. So this is, the boiled down version of what we're thinking about, and we're thinking of building on what we've already done. Again, it's not going to be just us alone. You've heard many names about the partners that we're either working with or considering doing.
Yeah, I know Pat from the Bms Foundation speaks very highly about the partnership she has with you, and I'm sure she would say thank you. We're running out of time, Amadou, so I'm going to combine the last two questions. So, in terms of the future, what do you think is, where do you think we can close the gap effectively? Do we have the ambition? Do we have the tools to actually make a difference? And if so, what's your hope for the future? And I don't know whether we go 3, 5 or 10 years time, you choose, but what's your hope for the future when it comes to cancer care and closing that cancer care gap in low middle income countries, for example?
I'm going to use a sentence that you know all too well, Cary. The question is, how do you eat an elephant? And eat one bit at a time. I think we just need to focus, all of us, on the priorities, the key priorities. Clearly, not a single group can solve the challenges that we've talked about alone. And therefore, I'm really enthusiastic that we have the opportunity to do this all together. So it's going to be about inclusive research, diversity in clinical trials, equity in access, education, access to innovation, and the opportunity really to get all of us focused on the same thing.
Okay, well, thank you very much, Amadou. So pass my regards to Kathy and John and the rest of the team. You do a terrific job, and we appreciate your support for World Cancer Day. I'm now going to shoot off to the local elephant restaurant and see if I can have something to eat, because you've made me hungry. Anyway, Amadou, as ever, it's great to talk to you. Have a great World Cancer Day, and we'll catch up soon, okay?
Thank you, Cary.
Cheers, bye-bye.
Bye-bye.